So hello everyone, our today's topic is leprosy. So what is the other name of leprosy? It's also known as Hansen disease that you have to remember. And what is the most common organism that causes leprosy? It's the Mycobacterium leprae species. Now remember, leprosy it's a chronic infection. So it primarily affects the cooler part of the body, such as the skin, mouth, and respiratory tract. Even eyes, it can involve the peripheral nerves, and apart from that, it can involve the lymph node. It can affect other organs like the liver, spleen, bone marrow, etc. So, can you name the primary areas of body that are affected by leprosy? Yes, they are the skin, mouth, respiratory tract, eyes, peripheral nerves, superficial lymph nodes, and the testes. So, this leprosy disease, it is caused by which bacteria? It's the Mycobacterium lepra bacteria, that is the causative organism. So, it appears like a compacted rounded masses that are known as globi, or they appears as cigarette in a pack. So they give appearance like cigarettes in a pack. Now how can you detect these bacilli? So these are the various methods. The first is the acid fast, that is the Jehan Nelson staining. It is similar to staining for M. tuberculosis, and it uses a lower concentration of the sulfuric acid. So, who can remind me what the Jehan-Nelson staining method it is generally used for? It is used to detect acid-fast bacilli, like the Mycobacterium tuberculosis. That is what you have to remember for your exam point of view. So it is used to identify the acid-fast bacilli due to their unique cell wall properties that retain the stain even after being washed with acid. So can anyone tell me why we need to use a different concentration of sulfuric acid while detecting a Mycobacterium leprae compared to the Mycobacterium tuberculosis? As the Mycobacterium leprae, it's more sensitive to acids. So we use a lower concentration of the sulfuric acid to avoid the decolorizing the bacteria. Other method that we can use is Gomori-methamine stain. So what is it's used for? So remember that Gomori-methamine staining, it is typically used to detect the fungal organism, and it is used in some bacteria. It can be used to detect M. leprae bacteria. Due to its ability to stain the organism's cell wall component that you would see under the microscope. Other method is molecular methods by PCR. So why do you think that molecular methods like PCR, they are important in detecting the bacterial infection? So these methods, they are highly sensitive and they can even detect a small amount of bacteria DNA. So remember PCR, it is a powerful molecular technique that amplifies the bacterial DNA so that allow you to detect the Mycobacterium leprae species. The other is IgM method, antibodies to PGL1 antigen. So what do these antibodies do in our body? So these antibodies, they help to identify and neutralize the pathogens like bacteria and viruses. So in context of leprosy, IgM antibodies to PGL1 antigen can be detected in the blood. So what are the some methods that are used to detect Mycobacterium leprae? So these methods are Jekyll-Nelson staining, Gnori-methamine staining, PCR, and detection of IgM antibodies to the PGL1 antigen. Now let us talk about the immune response. So remember, it can be either T cell response or it can be humoral response. In the humoral response, the lepromatous leprosy patient, they have high amount of immunoglobulin like IgG, IgA and IgM and antibodies to myobacterial antigens. Other are the T cell response. We have CD4 T cells and CD8 T cells. So remember, the tuberculoid leprosy patient would have predominantly it involves the CD4 cells, whereas the lepromatous leprosy, it shows excess of CD8 cells. So in the tuberculoid leprosy, remember CD4 cells, T cells, they play a major role, while in the lepromatous leprosy, there is an excess of CD8 T cells that fail to destroy the bacillus due to the defect. Now what is lepromin test? So lepromin test, remember, it is not a diagnostic test, but it is used to classify the leprosy based on the patient immune response. So there could be two reactions that could be seen. The lepromin test, it includes two main reactions. The one is the Fernandez reaction and other is the Mitsuda reaction. So the early reaction is the Fernandez reaction. So it's the early positive reaction and it appears as indurated area within 24 to 48 hours. So remember, Fernandez reaction, it's an early positive reaction that appears as indurated area within 24 to 48 hours after the test is done. And Mitsuda reaction, it is delayed reaction that occurs after 3 to 4 weeks. So Mitsuda reaction, it is a delayed reaction that appears as granulomatous lesion after 3 to 4 weeks. Now what does the positive reaction in the lepromin test indicates in the term of leprosy type and immune response? So it indicates a tuberculoid leprosy and a good immune response. So remember, patient with a tuberculoid leprosy shows a positive reaction in the lepromin test. that indicates a strong cell-mediated immune response. And what does the negative reaction in the lepromin signify? It indicates the negative reaction. It indicates lepromatous, leprosy, that indicates a suppressed cell-mediated immune response. So the lepromin test, it helps to classify the leprosy based on the immune response, indicating the level of the cell-mediated immunity in the patient. Now we can classify the leprosy. It is based on two types. One is the lepromatous leprosy that represents a low resistance, and tuberculoid leprosy that indicates a high resistance. According to Ridley classification, Ridley and Jopling classification, we classify it at tuberculoid polar that has a high resistance, highest resistance, to the lepromatous leprosy which has the lowest resistance. Other could be borderline tuberculoid, mid borderline and borderline lepromatous type. So total of 5 types. Now coming to the reactional leprosy. Remember these are of 2 types. The type 1, reversal reactions, that is seen in the borderline groups and categorized by changes in the immune state. And it could be upgrading reaction or the downgrading reaction. So in upgrading, there is increased cell mediated immunity that occurs in borderline lepromatous leprosy. The patient shifting toward the tuberculoid type. In a downgrading reaction, there is lower cellular immunity and it is seen in borderline tuberculoid type and patient shifting toward the lepromatous type. The type 2 is erythema nodosum leprosum. So it occurs in a lepromatous patient. After treatment, there you will see tender cutaneous nodules, fever, synovitis, lymph node involvement. Now these are the difference between the 2 types, lepromatous leprosy and the tuberculoid leprosy. So remember, the skin lesions in the lepromatous type, the skin lesions, they are symmetrical and multiple. They are hypopigmented. The lesions can be maculopapular or nodular, and that gives the faces appearance that would is leonine faces, that are loin-like faces. In the tuberculoid type, the skin lesions, they are asymmetrical. They are usually one or few lesions. So these lesions, they are hypopigmented and erythematous. So how does the skin lesion in the tuberculoid leprosy differ from those in the lepromatous type? Yes, they are symmetrical and usually fewer in number. The nerve involvement is present in the lepromatous type, but the sensory distribution is less severe. But in the tuberculoid, the nerve involvement is there, but there is distinct sensory distribution. So which type of leprosy has more severe sensory distribution? It's the tuberculoid type that has more sensory distribution. On histopath, in the lepromatous leprosy, you will see collection of foamy macrophages, or you will see lepra cells. So lepra cells, they are seen in lepromatous leprosy. So these cells, they are separated from epidermis by the clear zone. In the tuberculoid part, there is formation of hard tubercle, and these lesions, they erode the basal layer of epidermis, and there is no clear zone. So what is the histopath features that distinguish lepromatous leprosy from the tuberculoid leprosy? The lepromatous leprosy, they have foamy macrophages. There is presence of lepra cells that are separated by clear zones, while the tuberculoid leprosy, they have hard tubercle that erode the basal layer. Coming to the bacteriology, the lepromatous leprosy, they have lepra bacilli that appears as globi or cigarette in pack appearance, whereas the tuberculoid leprosy, the lepra bacillus, they are few, and they are seen in destroyed nerves as granular or beaded form. So in a lepromatous leprosy, there is a suppressed immunity that indicates low resistance, whereas in a tuberculoid leprosy, there is a good immune response indicating high resistance. The lepromin test is negative in lepromatous leprosy, whereas it is positive in the tuberculoid leprosy.